Hello and welcome to the stiffness-related pain track. You've taken the quiz, you've been classified as having stiffness-related pain. And so this class is going to give you all the tools and resources you need to get out of the stiffness-related pain and to get back on track with all the activities that you enjoy and love without having them compromise your pain. So let's look at the learning objectives here. Basically, we want you to understand what causes stiffness-related pain and what causes that stuck feeling. And then you're going to learn how to identify if you have stiffness-related pain. So before we jump in here, let's talk about stiffness-related pain. So when you're moving around throughout your day, your back is going to feel stiff. It might feel kind of rusty, like a rusty hinge that just needs some oil in order for you to, move easily. It may feel that way when you bend forward. It may feel that way when you bend backwards or when you rotate. It can be in any range of motion that you feel this. And so basically what we're going to do is kind of give your back the oil that it needs to get rid of the rust through some really gentle exercises so you can get back to a full range of motion, which is going to affect your entire life and really provide improvement that you need to do the things that you enjoy. So let's start with this first check here. Is your back stiff when you bend backwards? So we call this extension. So what you're going to do is you're going to stand tall, place your hands on the back of your hips, and gently arch your back as far as you can comfortably. Hold that for 5 seconds, come back to neutral, and you're going to do that 10 times. Now I want you to pay attention to where you're experiencing the pain when you do this. Is the pain only there, or the stiffness only there at the very end of the range of the motion? Is it there through the whole range of motion? Does it disappear when you just go back to neutral? What is going on when you're doing this test here? So now we'll do the forward bending position. So this is the opposite. We just did extension. We call this flexion. So in this example, this person is doing this on the floor. I don't expect you to do that. You can sit in a chair or you can stand, and then you're gently going to bend forward, letting your hands go as far down as comfortable. Hold that for about 5 seconds, and then you're going to bring yourself back up to neutral. You're going to do that for 10 times. Same idea here. Does the pain only occur when you reach the very end of what is comfortable for you, or the stiffness? Does it disappear when you sit back up to neutral? Just paying attention to the amount of stiffness that you feel when you're doing these assessments. So let's go into a deeper dive of what is happening with the assessment. So the first one that we did, we were calling that extension. That's when you were arching back. Where do you feel it? Do you feel it in the low back? Do you feel it higher up in the back? And do you feel more stiffness when you arch your back and lean backwards? Or flexion, that's the one where we were bending forward. Where do you feel it? Do you feel it in the front of your spine, the middle of your back? And do you feel more stiffness when you try and bend forward and reach your toes? So once you answer those questions, that will help you identify which of these you need to pay more attention to, and it is possible that you might have both.